I'm just going to give you a quick introduction to what is the Global Disability Innovation Hub. So what we are, our story is that we started from the London 2012 Paralympic Games, and that sparked commitments from our founding members, which you can see down the bottom are UCL, Loughborough University London, the Queen Elizabeth Olympic Park, and University of the Arts London, as well as Sadler's Wells, V&A, Helen Hammond Centre and Leonard Cheshire. And so in 2012, we thought, you know, it's nice, we're in the Olympic season now, we're about to have the Paralympic season. You should look out for a campaign that's going to be launched at the end of the Paralympics called We the 15. But that Paralympic spirit was alive and kicking in the UK. And we thought, how can we make a lasting legacy to the positive impact of the Paralympic Games? And so we set up the Global Disability Innovation Hub, and this is the Mayor of London launching it in 2016, which was just before the Rio Olympics, Paralympics happened. And so we launched the Global Disability Innovation Hub. We've become two things, an academic research centre and a community interest company, and I'll talk about that in a second. But one of our big projects at the moment, when we started in 2016, we didn't really know what we were going to be, if I'm honest. We had this great idea, but we weren't entirely sure how we could continue that legacy. And we spent probably the best part of 18 months talking to a lot of people. We spoke to everybody from the World Health Organization and the International Committee for the Red Cross, right down to local charities and disabled persons organizations in London. We also did scoping studies to Africa, to India. We tried to understand where we could make the most impact, because there's already a great deal of great work happening in disability innovation. And where we thought we could make the biggest impact was what we think of as a meso layer. Like there's this macro layer of like UN conventions, and that's amazing. And then there's lots of separate bits of work like the ALS MND Alliance. You could think of RNB, RNIB in the UK, for example. But maybe we could work across all of the different medical conditions, but also all of the different challenges. So whether it be in transport or inclusive design of the built environment, right the way through to innovation of products and services. One of our biggest programs at the moment is a £20 million, which is £40 million with match funding program to try and get assistive technology to people globally. So as much as we might be talking today about the next generation of technology and how we might build completely new ways of interacting with technology for people with varying abilities, when you travel to low resource settings, and to be honest with you, low resource settings don't necessarily have to be in poor countries. They can be in high income countries like the UK or the United States of America, but in poor communities there. And you find that people don't have access to things like a wheelchair, a communication aid. And I'm talking a basic communication aid. I'm talking about a board, a paper board with some pictures on it. And people don't have that level of access. So we're trying to work across policy and practice, as well as research and development and innovation to change that and to see what works and how we can make a difference. And we're having impact. So we've reached 21 million people so far and climbing, and we're beginning to get a number of countries sort of on the path to be able to scale their assistive technology policies and practices and new technologies to market. So on slide 6, please, Richard. So we have a new strategy. I'd encourage you to have a quick look through it. Love to hear your thoughts on it. One of the things in there is a 12-step process. So we start with community leaders. So this would be like one of the conversations we'd start with in a new area. Like how do we work with the people that know the problem best in the community? Then we try and build political leadership. That's both with a big P and a small p, so within the political systems, but also local politics. Develop a clear mission, develop some time limited actions, then think about governments, think about how we drive participation, look at expert mainstreaming training, look at developing resources, look at inclusive innovation work, and then getting to good enough. Like, you know, sometimes perfection can ruin anything happening, and then develop that culture and onto reflection and recognition of success. It's very important to recognize success, and I think the Paralympics does that very well. This 12-step model came out of the Paralympics. It's a research paper that's now published with interviews from all of the people that helped to implement, or the key stakeholders that helped to implement the Paralympic legacy. And it's sort of our guiding principles on how we begin partnerships. In slide 7, you'll see that, this just give you an idea of what we are. So you see in the centre there, you've got an academic, the slides are quite small, but the academic research centre and the community interest company. And then we have partners and stakeholders. So those three things come together and what we call the GDI hub ecosystem. So we work, everything we do is in partnership. We don't believe we can do anything alone. And what feeds in on the left-hand side, or the academic side, is we are the first and only World Health Organization collaborating center on assistive technology. And we have the only MSc in disability design and innovation, from whom you're going to hear from some of the students. So students you're going to hear from today come from 2 master's programs. One is MSc in human-computer interaction, and one is disability design and innovation. And then from industry, we have a GDI Hub Advisory Board, and we also have our founding partnership, and it all works together to try and accelerate disability innovation for a fairer world. So in order to structure what we actually do, number 8 there, if you can, thanks. In order to structure what we do, we have what we call domains and then areas of work. So the things that are going vertically down there, you see research, innovation, programs, teaching, and advocacy. They're the things that we do. So we do research projects, we have innovation ecosystems that we support in Africa, we work with an impact fund to invest in innovation. We've developed that with partners. We've delivered programs like 80-20-30, and obviously we teach. So we have our own masters in disability design and innovation, and we work on advocacy. So things like the We the 15 campaign, which will be launched soon. And in slide 9, I should just say we work across assistive and accessible technology, inclusive design of the built environment, inclusive edtech, and missing the 4th one without the slide, the climate change and climate resilience. So one of the things that's come out through COVID-19 and the work we've been doing on assistive technology more generally is there is a real link between inclusion and the climate agenda. So poorer people are most likely to be disabled. If you're a person with disability, you are most likely to be poor. And the same is true for climate change. So you will end up living in areas which are more likely to be flooded because you can't afford housing, say, in places which wouldn't be flooded. You're more likely to not be able to have the resilience towards climate change. So we are beginning to strengthen our work there. So finally, in slide 9, you'll see that we work in partnership on everything, like I've said. These are just 4 partnerships. The top left is the MSc. So the MSc is delivered over 3 universities. It's not an easy task to get that paperwork done, I can tell you. There's something like 180 pages of an agreement that we worked through over 3 years to get that in place. But our students love the interaction across the 3 different institutions. In the top right, you have a partnership with AMREF, where we are delivering Africa's first assistive technology accelerator. In the bottom right is the GATE community at the World Health Organization. And in the bottom left, we have the local communities that we're working with in Indonesia to develop accessible and assistive technologies with them. So you can find more. I've left some links. I'm sure they'll be available. They can be copy and pasted into various bits of chat about the GDI Hub. There's a Linktree link that's easier to navigate than the main website if you just want to quickly jump to strategy or the MSc. I've led the link for the MSc, and then of course the UCL Interaction Centre and the MSc in Human Computer Interaction